Hi, everyone. This is Eric Glazer, and I just want to invite you to the next live recording via webinar of the Bright Spots in Healthcare podcast, where we break down how to build and manage a virtual group appointments program to drive better results for the consumer suffering from a chronic illness, as well as reduce healthcare claims costs. If you are new to Bright Spots in Healthcare, each episode, I bring leaders together to not only inform you, the audience, but also unearth bright spots, successes at health plans, hospitals, and various other healthcare related organizations across our country. Our goal is to identify as many bright spots as possible so that you, the listener, can determine if the ideas shared on our show are applicable at your organization. We believe this approach of finding a bright spot and cloning it is the most effective strategy to improving healthcare in our lifetime. Most of our shows we record live so you could attend them via webinar. Our next episode is January 27th at 12 p.m. Eastern Standard Time, and it's entitled How Group Appointments Are Driving Better Outcomes in Chronic Care. I invite you to attend live by registering right here. This episode is going to be super interesting and informative. We're actually bringing together a unique roundtable of experts representing each stakeholder needed to launch a successful group appointment program. Again, registration, no charge. Just register here and come and join us for free. Ask questions live. We're going to have a representative that is a team leader on the program. We're going to have an actual patient there. We're going to have some physician leaders who oversee the program. We're also going to have an advanced provider who's part of the program as well. You're going to hear from each one of them so you could truly identify if you could bring this kind of program to your health plan or your provider organization in a very cost-effective, meaningful way that helps change consumers' lives. I highly encourage you to join. If you don't really understand the power of these appointments, on the registration page, we have provided you two links to big studies that have been published in journals. The most recent one is in the American Board of Family Medicine. It's entitled The Impact of a Novel Wellness Group Visit Model on Obesity and Behavior Change. It shows astounding results. There's a second study that's been published in the Sage Journal this past February. There'll be links to both of them in the registration page. You could check those out as well. If you cannot attend, subscribe to Bright Spots in Healthcare wherever you consume your podcasts. You can not only hear this episode, which will drop on January 28th, about 24 hours later after the live recording, but you can also hear a lot of our most recent episodes. In the past few weeks, we had Randy Oostra, CEO of ProMedica, on the show. We had Cara McNulty, President of Behavioral Health, on the show, and Dr. David Langer, Chair of Neurosurgery at Lenox Hill Hospital in New York and star of the Netflix docuseries Lenox Hill. Jim Malinowski, CEO of Genesee Health Plan, Dr. David Nash, the founding dean at the Jefferson College of Population Health, David Chase, the author and co-founder of Health Rosetta, and many, many more exceptional guests coming on the show, sharing success stories in their pockets of healthcare so that all of you could determine if these are things that you should bring to your organization. I look forward to keeping in touch. I hope you join the Bright Spots in Healthcare movement.